Good morning, everyone, most especially to our teacher, Ma'am Ohoylan. Good morning. I am Mylene Lady Rose S. Takan. And for today, we will talk about autism. Okay, first, what is autism? Joel Lazaro, a medical doctor, according to him, autism is a complex developmental disorder that affects the brain's normal developmental of social and communication skills. It involves a wide range of behavior. An autistic child may be withdrawn or exhibit inappropriate and intrusive social behavior. The child may not respond when his name is called, have poor eye contact, be indifferent to affection, or sometimes have inappropriate affection. He may also lack social and emotional empathy. He may fail to develop meaningful language skills. Some autistic children display immature language, such as echoing what was said, being unable to maintain proper conversation, and being unable to use gestures to communicate. An autistic child may also be resistant to change and be attached and fascinated with objects. He is not into imaginative play and instead plays with toys by merely lining them up or spinning them. Hand flopping, rocking, running in circles and repeating words, phrases, or songs may be exhibited. Autism affects about 1 out of every 500 Filipino children. Boys are 5 times more likely to have autism than girls, and there are 3 to 8% risk or recurrence in a family with one affected child. Family income, education, and lifestyle do not influence the risk of autism. There is no known prevention for this disorder. In the past, autism was thought to be a mental illness caused by bad parenting. This destructive idea has been disproved. There is evidence that genetics is an important but not an exclusive cause of autism, although no specific gene for autism has been identified yet. Some conditions such as seizure disorders and mental retardation can also be related to autism. So, is it autism? So what are the signs of autism? Signs parents should watch out for. Okay, as early as 1 to 2 years, signs such as the absence of speech and eye contact may already be present in a child. This may be observed by an astute physician or parent. Autism may also be suspected whenever a child fails to meet any of the following language milestones: babbling and gesturing, example, pointing, waving bye-bye, and 12 months, single words by 16 months, two-word spontaneous phrases by 24 months, not just echoing or the loss of any language or skills at any age. A specialist experienced in the diagnosis and treatment of autism should be consulted. Sometimes people are reluctant to make the diagnosis of autism because of concerns about labeling the child. However, the first step in helping the child is the correct identification and assessment of his abilities, strengths, and weaknesses. Failures to make the right diagnosis can lead to failure in getting the treatment and services the child needs. It is important to start intensive treatments early with emphasis placed on development of functional communication and social skills, as this greatly improves the outcome of most young children with autism. Treatment is most successful when geared toward the individual's particular needs. Intervention programs are also more effective when parents are actively involved and taught appropriate strategies for dealing with their children. Autism needs to improve in some cases significantly as children start to acquire language and learn to communicate their needs and influence other people. With appropriate intervention, many of the symptoms of autism can be improved, though most people will have some symptoms throughout their lives. Overall, Prognosis for individuals with autism is variable and is probably dependent on the degree of their disabilities and the kind of intervention that they receive. And that's all. Thank you.